Good afternoon, everybody. This is Dr. Anish. I am a consultant endocrinologist at Prathima Hospital, Endocrinology. So first things first, endocrinologist ante enti. So a lot of patients come to me, na kadupulo problem undi endocrinologist ki cheyaలని cheppesi. That is endoscopy. Endocrinologist ante we are a specialization of doctors who deal with hormone problems. Now the hormone ante chaala mandi what people say is they talk about menstrual irregularities, they talk about thyroid. A few people at least know that okay, we are the people who are specialists in diabetes. But typically just there are close to 20 to 30 hormones in our body, and every hormone will have problems. Every hormone will have problems. So today we are going to talk about a condition which is called as acromegaly. So a lot of few people wouldn't even have heard about this condition. Asli acromegaly ante enti? What is that? What happens in that? Is it a problem which happens in us? What happens in acromegaly? Correct. So acromegaly, ante, if you look at the name, it is derived from a Greek name, acro. Acro ante extremities. Extremities ante hands and feet. Megaly ante enlargement. So initially they told that this is a condition wherein the people are actually having extremely big hands, extremely big legs. And then later on, we got to know about why this thing was happening. After the development of all these hormone field, over the last 100 years, we got to know about what exactly was going on in all of these patients, right? So we'll just take a detour. How many of you people actually know about Dilip Singh Rana? Dilip Singh Rana is more commonly known as the Great Khali. The Great Khali, we all know him. He's a very big man. He has big hands, big feet, a very deep voice. He has a prominent jaw. He has a large tongue. He has prominent forehead, big nose. Do you know that Dilip Singh Rana suffers actually from acromegaly? So he is a person who actually had acromegaly. He had this disease, and this disease led to all these things. Do you know who else has the same disease? If you follow WWE, then you must be knowing about the Big Show or Andre the Giant. They are like very big people, very tall people. They actually have acromegaly. Even in music, even in arts, even in painting, even in acting, in a lot of films, we actually have acromegaly people. In fact, there was a female whose name was Mary Ann Bevan. The reason I'm saying about that female's name over here is, it was back in 1873 when she was born. She expired at the age of 59 years. But then, after her marriage, like she married a person and then she gave birth to 4 children. And then after that, slowly, she was a nurse. And she was pretty beautiful actually, before this disease actually came. And then slowly her face started changing. She started developing all these changes in her face. I'll be showing you the picture later. And then slowly, because of these changes, and her husband expired in 1910, and then because she had to feed her family, at that point of time she entered a contest which was dubbed as the ugliest woman on earth, and she won that contest. And then she stayed on for the next 20 years working in a circus, presented as the ugliest woman alive. So that's a very distressing thing, that's a very sad thing. She actually suffered from an illness which we did not even know about then at that point of time. Let's show you the picture about how Mary Ann actually looked before and after. So this was the nurse, this was Mary Ann, this was the nurse and how she looked previously. And this is how she looked eventually. So this is the person and this is how she looked purely because of the illness. So both of these are actually the same person. And this is the distress that acromegaly can have on you, right? So acromegaly is typically a condition which is seen because of an increase in a hormone. The hormone is called as growth hormone. So what is growth hormone? It is a growth hormone ante enti. Since the time of our birth, we keep growing in height. We keep growing in height till we are around 15, 16, 17 years, 15, 16 years. And then our height stops at that point of time. So what drives our height increase? How do we increase in height? Just because we are eating, we are not going to increase in height, because after 16, 17 years we are still eating. But our height stops. So what stops the height? What increases the height? It is growth hormone. We see a lot of people who are very short. Pygmies and very short people, dwarfs. Most of them, a lot of them actually have growth hormone deficiency. They have a problem in maintaining and making growth hormone. And దానివల్ల ఏమవుతుందంటే because of the absence of growth hormone, they don't increase in height. వాళ్ళు చాలా తింటారు, but they don't increase in height. They become obese, but they don't increase in height because that hormone which is necessary for height increase is not there. So while that is seen in deficiency of growth hormone, a few people can have an excess in growth hormone. చాలా ఎక్కువ ఉంటుంది growth hormone. And what happens because of that? They become tall. They become giants. So most of the people who have an increase in growth hormone before the age of 15 years, I'll be coming to the age of 15 years and the importance of that. So before the age of 15-16 years, they are giants. So we are looking at these people, like I told you, like the great Kali or Big Show or any of these people, they're all giants. Why were they giants? Because they had growth hormone right from their childhood, increasing growth hormone. So because of that, at every year, they were higher than their classmates, at every year. Most of us are very happy if our child is tall, right? But then that is when we have to actually find out what the reason for the tallness is. Our children cannot be just tall like that. They can be a disease which is leading to the height increase, right? So most of them were tall even before a certain age, and they were tall because of the increasing growth hormone. But what happens after that age? Like what happens, like just like I showed you the photo of this female, right? So what happens if a person gets an increase in growth hormone after the age of 20 years? At that point of time, the height won't increase. What would increase? The proportions would increase. So proportions, and what are we talking about? We are talking about the hands. They'll be having large hands. They'll be having large feet. So if you are having an increase in your shoe size, definitely get yourself evaluated for acromegaly. Get yourself evaluated for increasing growth. They'll be having a large nose, large eyes, large face, large thyroid. The jaw will be protruded like this, right? Like how you see. The tongue would be large. So because of that, they'll be having a lot of tongue bites as well. Typically, they'll be having a lot of sweating. So you'll be having all the sweat on the nose as well. It's a very typical sign. If you just see over here, you'll be seeing a lot of discoloration. That is seen on the nose, and that is because of an increase in growth hormone. They'll be having a protrusion of the forehead. Frontal bossing is what we call that. Many people would also be having all these wavy like bone structure at the level of the skull. So these are typically seen at the level of the face. Similarly, at the level of the hands, at the level of the feet, we can easily appreciate them. In fact, do you know, growth hormone can also cause an increase in the various tissues in the body. And by the tissues, we are talking about the heart. A very common thing which is seen in acromegaly, in an increase in growth hormone, is an enlargement of the heart. So what happens because of that? Because of that, the cardiac illness starts occurring. There will be a problem in the heart beating, there can be a problem in the heart functioning, there can be heart attacks, there can be heart rhythm abnormalities. There can be an enlargement at the level of the liver. When doctor checks Tuesday, there will be, oh, your liver is on the higher side in the size perigindani. There can be problems at the level of the kidney. So every single organ can be affected because of growth hormone, right? So I just told you, right? So a lot of you might be thinking, even the growth hormone ekunta manchide kada, my child is going tall. That isn't the case kada. Because what happens is, in acromegaly, there is going to be destruction of your joints as well. Most of the people who have this condition, they'll be having a lot of joint pains, unbearable joint pains. They'll be having diabetes. And this diabetes is not easily controlled also. We have to work hard to control the diabetes in an acromegaloid patient. They'll be having hypertension. They'll be having cancers in your intestine. Colorectal carcinomas are seen with growth hormone. And who has more colorectal cancers? Those who have more of skin tags. Like many people will be having skin tags. I don't know whether you people would have noticed. Skin tags more than 3 skin tags. They are at a higher chance of getting a colorectal cancer directly. They'll be having higher chance of getting a thyroid cancers. So it is not a straightforward condition. Your heart is going to get affected. Your mood is going to get affected. So it's not a straightforward condition. It is a very distressing condition which can decrease your life expectancy by 2 decades to 3 decades. People die early because of this. It's an illness. So we know what acromegaly is. But why does a person get acromegaly? Acromegaly is a condition which is seen because of an increasing growth hormone. And where does growth hormone come from? it comes from your brain. There's a part in your brain called as the pituitary. Like you have the liver, like you have the heart, like you have the thyroid, like you have the kidney. We all have a pituitary. It is situated behind our nose. And that makes growth hormone. And if there is a tumor in your pituitary, a tumor, it's a brain tumor. If there's a tumor in your pituitary, that will cause an increase in growth hormone, and that is seen in 70 to 80% of our cases. A few other cases might be seen, which is caused by tumors in other parts of the body, which is caused by an increase in secretion of growth hormone, an increase in the sensitivity of the growth hormone receptor, but these are all milder cases. The important thing is a tumor in your brain, and the problem is this brain tumor can increase in size and it can cause a lot of headaches. Headaches are a very typical symptom of acromegaly patients. They'll be having headaches, they'll be having vomiting sensations, they'll be having visual disturbances. Around visual disturbances, like let's just say I'm just seeing straight. I can see the sides also, but in a growth hormone deficiency patient, they're just seeing straight, they can't see the sides. They'll be cutting off of the vision, and that is because of the affection of the optic nerve. So it's a very important condition, and it is seen because of a brain tumor, because of a pituitary tumor. And whenever you have any of these conditions, just go and meet your doctor, get yourself tested for an IGF-1 level, because growth hormone increases the IGF-1, and IGF-1 increases all these things. It's an insulin-like growth factor 1, and get yourself tested using a dynamic testing. They'll be giving you some glucose and testing your growth hormone after an hour. Just by testing your growth hormone, we'll not know acromegaly or not, because it keeps fluctuating throughout the day in all of us. So we have to try to suppress the growth hormone by giving glucose. It's called as a post-glucose suppression growth hormone. So get this test done. And if you have a brain tumor, obviously go ahead for the surgery, because that's your best option. Or if the tumor is very large, if it is near your more important structures, then we can go for medications. Even after surgery, if the tumor hasn't been reduced, we can still go for a few medications. We can go for radiation therapy, but get yourself evaluated and know what growth hormone excess is. Most of us know about the story of David and Goliath, right? Goliath, who was a very big giant, it's like an old age fairy tale kind of story, wherein we had a very big giant, he was harassing all these people, and then a small boy called David comes up and he uses a catapult, and then he just throws a stone, and the stone hits David over here, Goliath over here, and Goliath passes away. The theory is Goliath also probably had acromegaly, because he had a family of acromegaly. It can be genetic. He had large hands, large feet. He had probably a very weak heart. In acromegaly patients, they'll be having this prognatism and this wide face which Goliath had, and they'll be having a weakening of bone, and so if some injury occurs over here, it's going to go and it's going to damage the brain, and a patient can immediately die because of that as well. In fact, even Abraham Lincoln, the famous president of US, was also hypothesized that probably even he had acromegaly. So it's a very common thing. It's a very, very common thing, because most of us also will be having latent acromegaly, wherein the symptoms are not even that easily visible. So if you have even the slightest of doubt, just go and visit your doctor once and know for acromegaly. So do we have any questions? Then please let me know for acromegaly. If you have any of their questions, which any of you people will be having, then we'll discuss about it further. So there's a question called as, what is the difference between acromegaly and gigantism? So that's what I'm coming to. Gigantism is a condition which is seen before the age of 15 years. So that's what I'm going to talk about today. So why do all of us stop growing after a certain age? What happens exactly in our body which is going to stop our height? It's a very important condition. It's a very, the absolute important question in endocrinology. Because most of the patients who come to me for short stature, they come to me at the age of 14, 15 years. What happens at that age is, the bones get fused. So let's just say, how do we increase our height? Because of the increase in our legs. Not because of our spine. It's mainly because of the increase in our legs. We grow in our legs, right? So in legs, there is always going to be a gap in this bone. That gap locally, the new bone is going on being added because of our hormones. So what happens is, at the age of 15, 16 years, the gap is going to be closed. So once the gap is closed, the height doesn't increase anymore. So that's the important concept. So if the growth hormone is increased before the gap is closed, then gigantism occurs. That is, the height keeps on increasing. And if growth hormone increases after the gap is closed, once the bones are fused, if the growth hormone increases then a person does increase in height, then the acral enlargement occurs. That is why it's called as acromegaly. So that's the difference between growth hormone, acromegaly and gigantism. So there's another question called as 18 సంవత్సరాలకే జుట్టు ఎక్కువగా రాలడం కూడా లక్షణంగా పరిగణించవచ్చా? ఇప్పుడు జుట్టు రాలిపోవడం అనేది ఇట్ క్యాన్ బి బికాస్ మీకు అండి యాక్రోమెగలీకి జుట్టు రాలిపోవడానికి అంత డైరెక్ట్ కండిషన్ లేదు, డైరెక్ట్ రిలేషన్షిప్ కూడా లేదు. యాక్రోమెగలీలో ఇన్ఫ్యాక్ట్ జుట్టు ఎక్కువ వస్తుంది, హైపర్ ట్రైకోస్ వస్తుంది, హిర్సిజం వస్తుంది. యాక్రోమెగలీలో ఏమవుతుందంటే అప్పుడప్పుడు వేరే హార్మోన్స్ ఎఫెక్ట్ అవుతాయి. ఆ వేరే హార్మోన్స్ ఎఫెక్ట్ అవ్వటం మూలంగానే మీకు జుట్టు రాలిపోవచ్చు, కానీ యాక్రోమెగలీతో డైరెక్ట్గా జుట్టు రాలిపోతే కాన్సెప్ట్లు ఏం లేవు ఇక్కడ. సో large growth in hands and feet can it cause low bone density? Low bone density is definitely seen in acromegaly, but it's not because of large bone growth. It is seen because the bone itself is not functioning very well because of the increase in IGF-1, which acts at the level of the bone. So most of our people who have acromegaly, they also have osteoporosis. They have weak bones. And fractures could cause them. It's not because of the large hands and feet, but yeah, low bone density is seen in acromegaly. Then we have another question. When to consult the doctor for such cases? I mean, best time to identify and get it treated. Please explain. So it's a very important thing. When I was doing my DM, I saw a few patients whom I didn't even think had acromegaly. But then where I worked, my seniors over there, my professors, they had suspected acromegaly, and then it turned out to be acromegaly. So a lot of people who have latent acromegaly, they can get missed till they get the proper typical changes. Typical changes say, if you are having large hands, large feet, large throat, large jaw, protrusion of your tongue, the vocal cords, the cords which are helping me talk, that also get protruded. Because of that, most people have a deep voice. They have a deep voice. If you are looking at hearing Great Khali speak or the Big Show speak or Andre the Giant speak, they have a very deep voice. Why does that happen? That's because of acromegaly. The voice becomes very deep. So if the voice change has occurred, then think of acromegaly. If the facial changes have occurred, think of acromegaly. If a patient suddenly is getting any joint pains along with diabetes and BP, get yourself evaluated for acromegaly. At least get yourself evaluated for a preliminary thought of acromegaly as well. So any headaches, these are very vague symptoms. Like any headaches, any diabetes, BP, any change in your shoe size, any change in your hand size, and any change in your facial parameters, get yourself evaluated, get yourself tested to know whether you have acromegaly or not. And then if you have acromegaly, get an MRI done, get yourself tested to see if you have any tumor in your pituitary. And if there's a tumor in your pituitary, go and get yourself operated. The operation doesn't mean you have to cut your brain, because it's just behind your nose. Nose nunchi operation chestar. It's a very straightforward operation, very easy operation. People do it. Even ENT doctors do it, as well as neurosurgeons do it. Very straightforward surgery. And then post-surgery, then again get yourself tested for recovery. Recover అయితే మంచిది, అవ్వకపోతే again meet your endocrinologist. Let him start you on octreotide or lanreotide or paclitaxel or cabergoline or some other medication like pegvisomant. So we have a lot of medications also. And then keep yourself testing regularly. The important thing is get yourself more and more think about the disease and think about testing for the disease in those people whom you even have a slight thought of acromegaly. It's a very difficult thing to tell people, because I've seen a lot of people whom I have doubts. But if I go and tell those people that, see, I think you have a problem, I think you have to get tested, people might feel offended. But still I do it, because it's an entire life that we are talking about over here. Right? We have another question. Is there any age factor for these symptoms to identify? As I said, it keeps changing. A typical non-familial and genetics are lane. Like my father doesn't have it, my brother doesn't have it, only I have it. That generally appears late, 3rd to 4th decade loss, like 30s, 40s. Can families from it can come very early, even within 10s loss. The gigantism typically runs in families. Many families, they have giant people. Probably most of them do have gigantism. We don't even know about that, right? Testing change karega. So gigantism actually runs in families. So it depends upon what kind of disease it is, but it can start even from the age of 5-6 years as well. At a very early age also, we can see that tumor come in our patients. There's another question. Sir, how do I identify that someone has acromegaly? Enlarged hands or feet are the major symptoms? Absolutely. Because that is how the name came up. Acro. And acro is feet and hands. Megaly, enlargement. That is how the name of acromegaly came up with. An enlargement of hands, enlargement of feet. But again, as I said, many people might be having latent. We cannot magnify it and see it. If we start magnifying, people will start telling that we have become very paranoid. So see for the other symptoms. The typical symptoms are headache, joint pains, deformities in the face, like increase in sweating, increase in acne, increase in skin tags, large nose, bossing of forehead, the forehead coming forward, the jaw coming forward, largeness of the tongue, deepening of the voice. These are typical symptoms which you can think if you want to know if someone whom you know has acromegaly or not. There's another question, how is it different from male and female? Absolutely no difference. It's just the same hormone which is being present. Now the only thing is a female might be having more of polycystic ovaries, a male might be having more of erectile dysfunction, because there's again going to be a problem in your sex hormone releasing hormone, GnRH, that is FSH and LH, follicular stimulating hormone and luteinizing hormone are going to go low because of an increase in growth hormone, because of the increase in tumor size, and that is going to cause a problem in the sexual functioning in a male. So andukane most of the males, they'll be having a small penis or they'll be having no pubic hair, erectile dysfunctions depending on when they're getting this. And females, because of the increase in IGF and because of the increase in fat and obesity, they'll be having more of polycystic ovaries as well. Apart from that, no difference, the same thing. Then there's another question, sir, ma babu 14 years, కానీ చాలా పెద్దవాడిగా ఉంటాడు, చేతులు కాలు కూడా పొడుగా ఉంటాయి, దీనికి ట్రీట్మెంట్ ఏమైనా ఉందా? ఇదే నేను చెప్పేది. పొడుగ్గా ఉన్నాడు, చేతులు కాలు పెద్దగా ఉన్నాయంటే రీజన్స్ చాలా ఉంటాయి, కానీ మోస్ట్ ఇంపార్టెంట్ రీజన్ ఏంటి? బ్రతుకు చెడిపోకుండా ఉండాలి కదా, లైఫ్ ఎక్స్పెక్టెన్సీ బాగుండాలి కదా. గ్రోత్ హార్మోన్ టెస్టింగ్ చేయించండి, ఒకసారి ఎండోక్రైనాలజిస్ట్ కలవండి. మార్ఫన్ సిండ్రోమ్ అని చెప్పేసి ఉంటుంది, దానిలో కూడా చాలా పొడుగుంటారు, చేతులు కాలు చాలా పెద్దగా ఉంటాయి. మళ్ళీ వాళ్ళకి ఏఆర్ అని చెప్పేసి ఉంటుంది అనమాట, అంటే గుండెల ప్రాబ్లం ఉంటాయి. అలా రకరకాల సిమ్టమ్స్ ఉంటాయి, జైగాంటిక్ సిమ్టమ్స్ చాలా ఉంటాయి. కానీ యాక్రోమెగలీ సంథింగ్ విచ్ ఇస్ వెరీ కామన్ అండ్ విచ్ వీ షుడెంట్ మిస్. అసలు మిస్ అవ్వకూడదు, అది అంటే ఒక బ్రెయిన్ ట్యూమర్తో అవుతుంది, సో మిస్ అవ్వకూడదు. సో గెట్ యువర్ సెల్ఫ్ ఒకసారి ఆయన ఎవాల్యుయేట్ చేయించండి. యాక్రోమెగలీ ఉంటే దానికి ట్రీట్మెంట్ ఇద్దాం, యాక్రోమెగలీ లేకపోతే దాన్ని ఎందుకు పెరిగిందని చెప్పేసి కనుక్కొని దాని ప్రకారంగా మనం ట్రీట్మెంట్ ఇద్దాం, రైట్? సార్, ఈజ్ వాయిస్ చేంజ్ లైక్ ఫీమేల్ టు మేల్ అండ్ మేల్ టు ఫీమేల్ ఆల్సో డ్యూ టు యాక్రోమెగలీ? అబ్సల్యూట్లీ నాట్ అండి. ఫీమేల్ టు మేల్, మేల్ టు ఫీమేల్ కాదు, ఫీమేల్ కూడా డీప్గా అయిపోద్ది వాయిస్, మేల్ కూడా వాయిస్ డీప్గా అయిపోద్ది. ఇన్ఫ్యాక్ట్ వాయిస్ మనకి చాలా డీప్గా అవుతుంది, చెప్పడానికి కూడా కష్టం. ఇట్లా 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 మాట్లాడతారు, అసలు వాయిస్ మారదు, ఎందుకంటే వోకల్ కార్డ్ దగ్గరే చాలా స్వెల్లింగ్ అవుతుంది కాబట్టి. కానీ మేల్ టు ఫీమేల్ అంటూ ఏం ఉండదు. దిస్ ఇస్ నాట్ లైక్ సెక్స్ చేంజ్ అని కాదు. వాయిస్ డీప్ ఎందుకు అవుతుందంటే వోకల్ కార్డ్ దగ్గర స్వెల్లింగ్ ఎక్కువ అయిపోయి, బికాస్ దిస్ ఇస్ నాట్ అ స్వెల్లింగ్ నియర్ ద వోకల్ కార్డ్స్, the voice itself becomes very deep and very intense. Just hear any of these people talk and you'll get to know how the voice is. Right? Are there any side effects with acromegaly? Like I said, first things first, there is a risk of mortality. The life expectancy itself is going to go low. As in, let's just say, మీరు 70 years బ్రతికే మనిషి మీరు 50 ఏళ్ళకి చనిపోతారు. ఇందాక మీకు చెప్పాను కదా పేరు, ఐ టోల్డ్ యూ అబౌట్ ద నేమ్ ఆఫ్ మేరీ అండ్ హన్నా బెవన్. సో షీ పాస్ అవే ద ఏజ్ ఆఫ్ 59 years. Andre the Giant, he was a very famous wrestler, acromegaly. He passed away before the age of 50-60 years. Those days treatment was not there. These days treatment is there. That's how the Great Khali and the Big Show, they all got these surgeries done. Or even like, we have a lot of pianists, we have a lot of artists. Many people who have acromegaly, right? Well, surgery undi kabatti they are surviving. Otherwise, people don't survive too. So the most important side effect is death. And apart from that, people will be having cancers of your thyroid, cancers of your colon. They'll be having mood swings. They'll be having heart enlargement, leading to heart defects, leading to death because of the heart. They'll be having joint pains. They won't be able to walk anymore. They'll be having diabetes, and then diabetes itself has a plethora of side effects. They'll be having BP. Lots and lots of issues are there because of acromegaly. So definitely get yourself evaluated. Apart from the obvious blindness which is seen because of the affection of the eye, the optic nerve because of the tumor. So it's a very important condition to evaluate. There's another question. Osteoporosis can be caused with this acromegaly problem? Absolutely it can be caused. As I said, Apart from osteoporosis, there can be osteoarthritis. Initially what happens is joint local space perugutundi. There will be a lot of pain, and then later on the space starts decreasing, and then a person will find it very difficult to walk. There will be deformities in the joints as well. Most of the people will be having carpal tunnel syndrome. Carpal tunnel syndrome and there will be swelling over here, deformity over here, because of which they will be having lot of pain in the fingers, lot of pain because of swelling and deformity over here. So a lot of these joint pains are seen apart from osteoporosis also, which is seen because of acromegaly. Is the food consumption style or type of food, can we impact any of our food to prevent acromegaly? Absolutely not. It's the tumor. No food which we eat is ever going to affect our tumor. It is something which even if we get is just like a bad luck kind of thing. It is seen in 6 people per lakh or 3 per 50,000 people. Again, it's like a rough estimate. So 6 per lakh sounds very rare, Kani. If it happens to us, it's absolutely not rare, because anything can happen to any person. Just be on a lookout for it. And the food consumption doesn't affect your growth hormone functioning, your growth hormone secretion, or any of those things. So don't worry about that. There is another condition called as acromegaloidism or pseudoacromegaly. Pseudoacromegaly ante entante, people typically look like an acromegaloid patient. Large hands, large feet, koncham facial changes, koncham joint pains. Can చూస్తే వాళ్ళ growth hormone normal ఉంటుంది, IGF normal ఉంటుంది. So they don't actually have acromegaly, but they look like an acromegaly. They are called acromegaloid or pseudoacromegaly. It is seen because of a condition called as pachydermoperiostosis or many other conditions. Even just because of obesity also some people may look like acromegaly. So there is another condition called pseudoacromegaly. That's why we are getting the testing done for. The pseudo we can't tell this acromegaly and start doing surgery, because we need to know whether this is acromegaly or not. And that's the next question. What are the common tests which are available for acromegaly to diagnose? And at what age do we need to undergo these tests? It's not about the age, as I said. Whenever you are getting the condition, get yourself evaluated. Age is not even a factor in acromegaly. It's not even a factor. If you have any of these typical symptoms, get yourself evaluated for acromegaly. So how do we get ourselves evaluated? So just a little bit of a gist. Growth hormone comes from here, it goes to the liver, it will tell the liver to make IGF-1, and IGF-1 performs all the functions of your growth hormone. So IGF-1 is your actual culprit. So IGF-1 should increase if you are having an increase in growth hormone. So get your IGF-1 done. If it is high, it is the most sensitive test. If it is high, that means the growth hormone chances chala ekku untayani. Ekku unde chances. And then we have to see whether the growth hormone is actually increased. So we give a patient glucose, 75 grams of glucose, and then after an hour we check for the growth hormone level. And if the growth hormone is less than 1 nanogram per ml or less than 0.4 nanogram per ml, if your assay is very sensitive, then it is fine. But if it is increased, that means suppress avatledani. Normally glucose should suppress growth hormone. And if it is increased, that means you might actually be having a growth hormone excess. And if you have a growth hormone excess, then do an MRI. If your MRI is showing a tumor, that means you have a diagnosis. If it is not showing a tumor, then you start evaluating for the other parts of your body. Get a CT chest, get a CT abdomen. Look for what other tumor in your body can actually cause an increase in growth hormone, and then work accordingly based on that. If you don't find out any reason, then you can just go for pegvisomab as a treatment. So we have finished all the questions which have been asked. The important thing is just get yourself tested for acromegaly on a regular basis and get yourself evaluated. All the best.